Skin lesions are abnormalities in the skin that can be indicative of various conditions. They are broadly categorized into primary and secondary lesions based on their characteristics and how they evolve over time. Primary lesions are the initial changes in the skin and are directly associated with the underlying pathological process. These lesions develop on previously healthy skin. Macule, a flat, circumscribed area of color change less than 1 cm in diameter. Example, freckle. Papule, a solid elevation of the skin less than 1 cm in diameter. Example, mole. Nodule, a solid, elevated lesion larger than 1 cm in diameter. Example, cyst. Vesicle, a circumscribed, fluid-filled lesion less than 1 cm in diameter. Example, herpes simplex. Bulla, a vesicle larger than 1 cm in diameter. Example, blister. Cyst, tubercle, abnormally developed sac that contains pus, semi-fluid, or morbid matter, above or below the skin. Pustule, raised, inflamed papule with a white or yellow center containing pus in the form of a lesion. Tumor, abnormal mass varying in size, shape, and color. Wheal, an itchy, swollen lesion that can be caused by a blow, scratch, insect bite, or urticaria, skin allergy, or the sting of a nettle. Secondary lesions result from changes in primary lesions or external trauma to previously normal skin. Keloid, a thick scare resulting from excessive growth of fibrous tissue. Crust, dried serum, blood, or pus on the skin surface. Example, impetigo. Scar, cicatrix, slightly raised or depressed area of the skin that forms as a result of the healing process related to an injury or lesion. Ulcer, loss of epidermis and dermis, often with necrotic tissue loss. Example, pressure ulcer. Fissure, linear crack or break from the epidermis to the dermis. Example, athlete's foot. Excoriation, linear or punctate erosions caused by scratching. Example, damage from nail biting. Scale, thin, dry, or oily plate of epidermal flakes. Example, dandruff. Understanding these lesions and their characteristics is crucial for diagnosing and managing various dermatological conditions.